COVID-19 hit the Republic of Korea only 2 months after a report on the cases in Wuhan, China. In early March 2020, the WHO declared COVID-19 a pandemic. In 2015, when Middle East Respiratory Syndrome, MERS, hit the Republic of Korea, MYONGJI Hospital successfully treated 5 confirmed cases, while containing the further spread of the infection throughout the hospital. This success is attributed to MYONGJI Hospital's infectious disease response team and their preparedness by training in infectious disease response 1 year prior to MERS's advent. Following the first COVID-19 reported case in the Republic of Korea, MYONGJI Hospital immediately initiated the COVID-19 response team and faithfully responded by delivering necessary medical services. During the past 11 months, MYONGJI Hospital has treated more than 110 confirmed cases. MYONGJI Hospital's COVID-19 response system has been well recognized as the representative of K-quarantine model, domestically and internationally. The recent research article published in the Journal of Hospital Infection proves MYONGJI Hospital's reputation in COVID-19 response. A distinguished group of physicians at the MYONGJI Hospital co-authored the research paper titled Providing Essential Clinical Care for Non-COVID-19 Patients in a Seoul Metropolitan Acute Care Hospital Amidst Ongoing Treatment of COVID-19 Patients. A majority of acute care hospitals have witnessed a significant decline in non-COVID-19 patient volume. This event was more pronounced in MYONGJI Hospital, one of the nationally designated control centers for infectious diseases. However, the number of patients with acute diseases and emergency patients did not decrease. And ironically, the quality of clinical care for patients improved. The research explains that the secret of this success lies in dual-track healthcare system, which highlights the allocation and utilization of medical resources. MYONGJI Hospital's core strategy for COVID-19 response is the dual-track healthcare system. It suggests the ratio of 2 to 8 when allocating the resources to COVID-19 patients and non-COVID-19 patients. The 5 critical components of the dual-track healthcare system include 1. Space compartmentalization. 2. Appropriate allocation of manpower. 3. Use of a buffer zone where the provision of essential treatment continues for inpatients while awaiting COVID-19 RT-PCR test results. 4. Competent in-house COVID-19 testing laboratory around the clock. 5. Real-time communication tools among entire medical staff. MYONGJI Hospital ensured that medical treatment of infected patients was delivered in a completely separate medical center area where ongoing essential care of non-effective patients occurred. Each floor of Building E in MYONGJI Hospital, so-called the Eco Ward, is distinctively separated to serve different purposes. MYONGJI Hospital assigned an exclusive group of medical staff for infectious disease, and the staff applied strict disinfection practices among themselves. Negative pressure angiography rooms and operating rooms with dual negative-positive pressure systems are operated to provide medical procedures and surgeries for emergency patients. MYONGJI Hospital also used Admission Screening Unit, ASU, and Pneumonia Surveillance Unit, PSU, as a buffer zone. MYONGJI Hospital's capability to operate a 24-hour COVID-19 testing laboratory enabled the buffer zone to run efficiently and effectively. In addition, valuable lessons learned during the MERS crisis, such as effective communication among hospital staff, were evident in MYONGJI Hospital's ongoing response activities during this pandemic. A variety of communication channels were activated to allow groups among staff to communicate effectively, and Shinko Pabal, a newsletter on COVID-19 response guidelines and process, was published daily to maintain the staff updated. MYONGJI Hospital has played a leading role in K-quarantine model, and partners around the world have shown their interest in learning about MYONGJI Hospital's COVID-19 response system. In response to the requests, MYONGJI Hospital has disseminated its ingenuity and valuable information through numerous virtual events with the Mayo Clinic and UN organizations. MYONGJI Hospitals shared its expertise also with the International Hospital Federation, Hospital Management of Asia, Korea Disease Control and Prevention Agency, and other distinguished organizations. MYONGJI Hospital endeavors to impart expertise based on the COVID-19 response system experiences to various regions of the globe. No clear light at the end of the tunnel in this pandemic. How can we keep hospitals safe and effective amid the ongoing crisis? How can we provide the best care for both infected and non-infected patients? How can we secure golden time for acute and emergency patients amid public health crises? Under dual-track healthcare system, MYONGJI Hospital gained the trust of our patients by maintaining its core functions in essential healthcare delivery for the community.